Well, I'm a big fan of all the vaccines, but really the one we're looking at as the most important tool is the influenza vaccine. This is one we've talked about many times in the past, and we really want people to get on board this year in a way that they really have never done before. COVID can look just like the influenza virus infection. And so when someone presents, it's going to be very challenging for us to distinguish between the two. So the more people who get a flu vaccine, the fewer people are going to get influenza. So when people do show up with those symptoms, we can start making a risk assessment. Hey, you got vaccinated, it's less likely you got flu, more likely you have COVID-19. That really helps us and obviously people understand what's going on. A lot of people get flu every year. A lot of people get very sick, end up in clinics, emergency departments, end up on our acute care floors, like our regular hospital floors, and in our ICUs. So if we can do anything to decrease that number across the entire country and across the entire planet, if we do see a lot of people with COVID-19, we'll be able to preserve more capacity, right? More beds, more office visits in our emergency departments, in our clinics, and in our hospitals going forward. People always are really curious about how good the vaccine is, and unfortunately, we don't really know the numbers until probably midway through or towards the end of the flu season. The most important thing is that even in the years where the vaccine was the least effective, it still had a substantial impact on preventing influenza. And you have to remember, even if it only prevents 20% of visits to the clinic or emergency department visits or people being into the hospital, that's a big number when you think about the entire United States, you think about all of North America, or you think about the globe. Really, the message that we should be delivering and that people should be hearing is that unless a doctor or a nurse practitioner or a physician assistant tells you you should not get vaccinated, you should assume you're going to get vaccinated. We actually, we don't know what's going to happen with flu and COVID-19 because they're both kind of are in the same natural space. And one may outcompete the other, or they may work together. We still don't know how many people who have flu and have COVID-19, or have COVID-19 and another respiratory virus. So as it stands right now, it is unlikely that a flu vaccine will protect you from COVID-19, but certainly having flu and COVID-19 at the same time would be much, much worse than having one at a time. When we think about the measles, mumps, rubella vaccines, influenza vaccines, human papillomavirus vaccines, like the whole, schedule of vaccines, right? That all depends on showing up for your regularly scheduled pediatric visits. Now's the time to start working with your primary care doctor about when to do it, right? So what we can't do is sort of get everyone who missed their primary care appointments in August. And so what I think clinics are really challenged by, but are working through, is how do they start working through that backlog?